So for several years, you have been involved as a patient representative in the development of policy and guidelines, healthcare professional education and publications that help us as healthcare professionals deliver heart failure care. How did you get involved in that?
That really sort of followed up on my search for information. There's a particular charity in the UK which is specific to my condition, to cardiomyopathy. And they did things like they ran information days where cardiologists would come and talk about the condition. There was the opportunity to meet other patients to find out what their lives were like. And to my surprise, there were people still alive after 5 years or 10 years with my condition. And so whilst I was in a devastated state, and my wife was as well, it at least gave me the opportunity to get more information. And I started to become involved in their activities, in things like support groups and perhaps talking to clinicians at education days about cardiomyopathy. And they told me one day about the English NICE organization, which creates guidelines and makes approvals for drugs, that they were refreshing the heart failure guideline and they needed 2 patients. And I just applied and I was accepted to that committee. So that really started me on this activity in terms of formal materials. And I joined that because really I wanted to try to make sure as far as possible that the patient voice was reflected in these guidelines. I mean, recognizing that these are for clinicians for best practice around treatment. But there were certain things that I found in my own treatment or as a consequence of my own diagnosis where I thought there might be some changes that could be made, and to see whether it might be appropriate to reflect these in the guidelines.
Have you benefited from being involved in these processes?
Yes. And again, this goes back, and perhaps we're talking really about me and my way of dealing with a problem. And it is that quest for information to really try to understand it. And so it was to my advantage to be on these committees, to meet clinicians, and just listening. I found the debates fascinating as they weren't arguments, but they were very strong debates between the interventionalists and the traditional cardiologists, and then maybe the specialist heart failure nurse and the GP. And all of these discussions I found fascinating, and I learned a lot. So to that extent, I did benefit. Yeah, I don't think it didn't improve my condition or the quality of my condition or my eventual recovery to a certain state, but it certainly helped my mental state of mind and I came to an emotional acceptance of my condition earlier, I think, simply by being in this sort of environment. Yeah.
And from working with you in these environments, it certainly helps us as healthcare professionals develop better guidance, as well as how research is defined, as well as how we deliver services. And I think it's great to highlight that to other people who are living with conditions, how it's not for everyone, but if they do want to get involved, the benefits they can get from it. So thank you for that.